Fenit Nirappil, the Washington Post, thank you so much for joining us. We appreciate it.
Thanks for having me.
So it seems that the Biden administration, while they have declared the public emergency regarding monkeypox, have they been slow in declaring that public emergency and kind of behind the eight ball in acting on how to deal with monkeypox?
Yeah, so a lot of the experts that we've been talking to are seeing echoes of the early mistakes with the coronavirus pandemic in the response to monkeypox. And we're getting the big question of have we learned nothing from coronavirus? Because in the early days of monkeypox, we were seeing real struggles to get people tested for monkeypox. There was a large, cumbersome process to authorize testing. There were delays in getting vaccines available into the United States when we could have been administering a lot more shots a lot earlier. And that was different. We didn't have vaccines for COVID until almost a year in. And here we did have vaccines that were effective in both curbing the spread because they can work after someone's been exposed to the virus and they can work proactively. And then we also saw delays in getting people treatment. So, on the declaration of the public health emergency, itself, the Biden administration was in a bit of a bind with that because there's demands on them to declare public health emergencies over abortion, over gun violence. So declaring it for monkeypox could have ramped up the pressure to do so with these other hot button issues as well. But the declaration of the emergency, now that it's in place, experts are hoping that this is going to send up signals that monkeypox has to be taken seriously and that this is something doctors and public health authorities have to be paying attention to because that's one of the big challenges that we're facing with monkeypox is that even though experts are paying attention, it's in the headlines. There's a lot of doctors and public health officials who haven't been caught up to speed with monkeypox. So when people are coming to the doctors with rashes, monkeypox isn't necessarily on the radar. So they're not getting tested, they're not being referred for vaccination. And I've talked to so many patients who are talking about having to educate the medical professionals and the medical establishment about monkeypox and what to do about it. And you can imagine that if some of the most well-educated monkeypox patients have to do that, what about for people who are disenfranchised?
Right, right. Puts them way behind the eight ball.
So,
Plus, it seems like a perfect storm of calamity here.
yeah. Do you think with this declaration of an medical emergency, do you think we have a good chance of catching up to this thing, or are we on the brink of it spiraling out of control like COVID?
Yeah, it's so right now, we have more than 7,000 cases in the United States. So unlike coronavirus, monkeypox doesn't spread as easily because it's not airborne and it's not airborne, and while it can spread through respiratory droplets, it's under pretty limited circumstances, and it's usually when someone lives in the same house as a person. But the primary way that it's spreading right now is through sex, and within the gay community specifically. But the more people who are contracting monkeypox, the more likely it is to keep spreading and gaining a foothold. So experts are worried that we're going to see a situation where monkeypox joins the likes of chlamydia, syphilis. HIV is just one of those illnesses that's out there and circulating through sex, even though monkeypox isn't considered a traditional STD. And then on Friday, we saw a bunch of children getting vaccinated in Illinois because there was a daycare worker who had tested positive for monkeypox, who had also been working as a home health aide. So there's concerns here about both the client and children starting to get monkeypox as well. And this gets back to what experts are saying when they say that this is not a gay disease, because it doesn't only spread by sex. Viruses don't know sexual orientation, and because it spreads by close contact, there is a concern here that it's going to spread more broadly within the American public.
Well, you know how the right wing will take any opportunity to weaponize anything, basically. I mean, do you think that there's going to be a movement to portray this as a gay disease? Because when it first started, it didn't appear to me that was sort of the indication, but it certainly has become that.
Yeah, this is definitely an issue that's out there. You're seeing conservatives and you're seeing right-wing figures use monkeypox as a cudgel against gay people to point to this as another example of degenerate gay people to summarize what they're saying. Usually the rhetoric that I'm seeing now is to paint the CDC and public health establishment as hypocrites for telling people to avoid gatherings to prevent the spread of coronavirus, but not shutting down big gay events or telling people to stop having sex to contain the spread of monkeypox. And these are two very different diseases, I want to be clear,
Hmm.
because coronavirus is airborne. It spreads very easily, and when we talked about flattening the curve, I think it gets lost that the whole point of flattening the curve was not necessarily to stop infections completely. It was to protect the hospitals. Because with something like coronavirus, you had a serious concern here that when you have millions of people all getting sick at once, that the hospitals were going to be overwhelmed and weren't going to be able to treat people anymore. The hospitalization rate with monkeypox is far lower. Based on sampling, it looks like less than 10% were hospitalized and usually associated with pain management. So we don't face the same kind of situation with monkeypox threatening to bring the healthcare system to its knees. And also, monkeypox is far less likely to be deadly than coronavirus. There haven't been any U.S. fatalities reported so far, and there have just been a handful of fatalities reported in the entire global outbreak.
There was a an opinion piece in the Washington Post today from Ray Lewis Thornton, an activist, an AIDS activist that's been living with the HIV. And the point of the opinion piece was really that making the same mistake that we did in the past with dealing with HIV and AIDS, or really in some respects, not dealing with it well at all
Yeah.
from a government standpoint, but now also kind of putting it in that, I guess, the gay category, which only then stigmatizes and it creates a bigger problem. Is that something that you're seeing and a serious concern in the gay community, particularly in dealing with monkeypox?
Yeah, the parallels to HIV are so eerie. I mean, just remember the early days of the outbreak. It's like you have gay men who are presenting with unusual, unfamiliar rashes with this rare virus. That's exactly how HIV started. And then when we say that monkeypox is not a gay disease, HIV wasn't a gay disease either. But I also do want to be clear here because I think sometimes there's an overcorrection that's happening that because anyone can get monkeypox, we shouldn't be talking about the fact that it's concentrated among gay and bisexual men, because even though anyone can get monkeypox, the risk isn't equal, and like should acknowledge that these infections are overwhelmingly among gay men because that's where the danger is. That's where the risk is. And when we have limited resources, when we only have so many vaccines, when we have only have so much treatment, the people who are at the highest risk should be getting priority for those limited resources. And if we emphasize too much that anyone can get it, I mean, I already see this on social media all the time where people hear that message of anyone can get it and think that all healthcare workers should be getting vaccinated or all children should be getting vaccinated ahead of the school year. And the experts that I talk to say that's a foolhardy approach because the risk for exposure is uneven and it's right now heavily among gay men and through sex in particular. And it's also important in public health that we be honest about risk and we not be alarmist. And this isn't something that every American needs to be worried about in the way that every American needed to be worried about coronavirus. I will say that it is a concern that if we don't contain this outbreak, it does pose a higher risk to the broader American public down the line that we're going to have like a new disease circulating in the country that we didn't have to. And that's the whole cornerstone of public health. Is I feel like the goalposts have been changed after coronavirus. That now, when we think about public health threats, we're thinking about something that's putting the whole country at risk, that will create millions of infections, millions of cases. I mean, when we think back to H1N1, when we think back to Zika and Ebola, these were public health threats that the country was taking seriously, because when we have the tools to stop a new disease threat, we should be taking them, because even if it's affecting a couple thousand people, a couple hundred people, we have the ability to stamp out viral and disease threats, and public health mobilizes to do that. So in some ways, what we're seeing with monkeypox is traditional public health in action, and the way that we were responding to diseases before we responded to coronavirus.
I know that one of the big issues has been getting vaccine, and a friend of
Yes.
mine who is gay told me that he had gone in to try to get a vaccine locally. He's same age as me, 69. He said
Where does he live?
he lives in Seattle, and actually people here have had some issues in getting the vaccine. He was saying that he had friends that went to Canada to get it, and
Yeah.
they had were able to have access to it very quickly. Now they did have a vaccine event here in Seattle over the weekend, but it still is slow, and for people to get vaccine here, what's going on if you can go to Canada and get it and you can't get it here in the States as quickly?
What we're seeing is the failure of the U.S. government to stockpile vaccines in the event that we have an outbreak like this. So monkeypox and smallpox come from the same family of viruses, and we are very much concerned about the dangers of smallpox and weaponized and used as a biomedical weapon against the United States. So we do have a significant stockpile of ACAM 2000, which is an older generation of vaccine. It can be used for both smallpox and monkeypox, but there's a newer generation vaccine that's specifically licensed for monkeypox called Jynneos. And we had a very limited supply of Jynneos heading into the monkeypox outbreak. And the Washington Post and others have reported about how we had an opportunity to order many more doses of the Jynneos vaccines, and that hundreds of thousands of doses were awaiting inspections and not available in the early days of the outbreak. So the federal government has made orders for additional Jynneos doses, and we're supposed to get nearly 7 million doses available by the middle of 2023. But right now, federal officials estimate that there's about 1.6 million high-risk individuals, mostly gay, bisexual, and other men who have sex with men. And in the coming months, we're not going to have enough vaccines to vaccinate everyone who falls into a high-risk category. And then if you have a situation where where the virus starts spreading to other demographic groups, or if we're seeing more children get infected, we won't have enough vaccines to proactively inoculate other Americans against monkeypox as well. So one of the things I've been hearing from experts is, what's the point of having a strategic national stockpile if we aren't in a position to respond to an outbreak of viruses like this? What would have happened if smallpox was weaponized against the United States and we didn't have the newer generation vaccine available to use?
If you have been vaccinated for smallpox, I have the mark on my arm.
Yeah.
Yeah.
Um, uh, are you, I guess, vaccinated already against monkeypox?
This is something of an open question, because there's not really robust data on how effective it is against monkeypox. To be clear, right now what we're seeing with monkeypox, it's an unprecedented global outbreak. Previously, it's been endemic to countries in Western and Central Africa. When public health authorities have been asked this question, they say it's a good idea to get vaccinated again, because we don't know how robust and how prolonged that vaccination you may have received decades ago against smallpox will be in protecting you against monkeypox. And also, like, while the theory is that the smallpox vaccines will be effective against monkeypox, it's also something that hasn't been fully studied. So we don't have as much robust data on the effectiveness of smallpox vaccines against monkeypox in a way that we do with coronavirus vaccines. So long story short, it's not the kind of thing that you can feel like confident that because of your smallpox vaccine decades ago that you'll be protected against monkeypox.
Right.
So, what do you think is, there's so much misinformation
My
and
God,
just
yes.
just the sense of, just how social media spreads stuff. What should people really know about monkeypox and how to conduct their lives around it? Because, you start reading the headlines, and of course, anything that is emphasized in the headlines becomes front of mind. So, I mean, where should people put this in their lives to give it proper perspective?
Monkeypox is not something that you should be panicked about, or that you shouldn't be processing it in the same way that you process or change your life around coronavirus. I mean, as of now, monkeypox really poses the biggest threat to sexually active, gay, bisexual, and other men who have sex with men. It's not homophobic to say this. This is where the risk is. This is where the highest levels of exposure are. It is homophobic to treat this as a reason to stay away from gay people or to criticize criticize gay people or to otherwise fuel your homophobia. Um, Monkeypox spreads through intimate, close contact, especially with someone who has active rashes and lesions. Sex provides a great opportunity for close contact with rashes and lesions, especially because they can be very subtle and look more like pimples and in hard to spot areas. So that's part of the reason why we're seeing the spread is because you may have seen those photos of African children with bumps all over their body. That's not necessarily how it looks with this current outbreak. We're seeing more rashes that are concentrated around the genitals. So what I would say is that if you are a sexually active man who has sex with other men, it's important to be vigilant about monkeypox. It's good. It's a good idea to inspect your partners for rashes or to inspect yourself for rashes and lesions because that's the situation where the virus is going to spread. The CDC and the WHO is now saying it's a good idea to limit sexual partners, at least temporarily, until you can get vaccinated. This is something of a third rail in public health because we've learned from HIV and other STIs that calls for abstinence don't necessarily work and that you shouldn't be telling people to avoid sex outright. But what they're trying to do with this one is say, like, look, like we acknowledge that sex is an important part of life, but it's just a good idea to consider reducing sex or limiting your partners just temporarily until you can get more robust protection. And the best protection against monkeypox is believed to be 2 weeks after your second dose of the Jynneos vaccine.
Yeah. So, like all medical emergencies, it disproportionately affects people of color. How,
Yes.
how vulnerable are, I mean, outside of, gay men and bisexual men having sex, what threat does it pose to communities of color that may
Well,
not
what
have the access to all the medical care they need?
Yeah, so there's a new study that came out from the CDC last Friday. So, in more than 1,000 cases where they had data on race and ethnicity, 41% were white, 28% were Hispanic, and 26% were Black. And we've been seeing cases disproportionately affect Black people as the outbreak spreads, because the data we have there said that 12% of cases were among Black men between May 17th and July 2nd, and that ballooned to about a third of cases between July 3rd and July 22nd. So One of the things that we've been seeing with HIV and other infectious diseases is it just has an easier time spreading in smaller social networks. And in public health, we've seen historically that Black gay men and other men who have sex with men are more inclined to have sex with other African Americans. So you have just a smaller social network, even if there's not a substantial difference in the amount of sexual partners or in the types of sexual behavior. When you just have a smaller community, it's easier for diseases to spread within that community. And remember how I was saying earlier how you have a situation when a lot of doctors don't even have monkeypox on their radar, and people are having to fight their doctors to say, hey, I might have monkeypox here. You should order a test. You should consider monkeypox as a diagnosis. We know from robust research in the healthcare industry that there's more discrimination against Black and Hispanic patients, and that they're more underserved by the medical community. So when you have access to fewer healthcare resources, it's even more challenging to get doctors to take monkeypox seriously. So there's a serious concern here that, especially as you have limited resources, fewer people of color are going to be receiving those resources in the fight against monkeypox, and they're going to have an even harder time advocating for themselves and getting the medical establishment to take the prospect of monkeypox seriously. And like, I don't want to downplay the struggles that white gay men are facing here too, because there's also an equity issue in how the health establishment treats gay people and the health officials of gay people. I mean, I hear this sentiment from healthcare workers in my family where there's a lot of tut-tutting and people saying, oh, well, gay men are just having so much sex and they're bringing these diseases onto themselves. And that flies in the face of the do no harm and non-judgmental values of the healthcare industry and what doctors and other healthcare professionals should be doing when they're going about um, the services that they provide to the public. So you're seeing a double layer equity issue here where you have a disease that's disproportionately affecting gay men, and they already face marginalization by the healthcare industry. And then within that, you have people of color who are being disproportionately impacted, and they all face two layers of marginalization, being both of color and being of the LGBTQ community.
Right. So going ahead now, how do you see, I guess, our reaction in this country and government reaction in dealing with monkeypox? Obviously, it's really fluid.
Yeah, for the heat that the Biden administration does get in some of the slowness in responding early to the outbreak, some of the longtime HIV activists that I talked to say they do deserve credit for being much different in how they handled monkeypox compared to, let's say, the Reagan White House in the 1980s when Ronald Reagan took years to even utter the words AIDS. And the press secretary in the White House there made a joke about, well, I don't have AIDS, do you? When he was asked about the burgeoning crisis affecting gay men. So right now you have the White House that's in regular communication with activists from the LGBT community and with expertise in HIV. You did see the declaration of the public health emergency. So there's a lot of pressure on the Biden administration to act swifter and to act with far more urgency than they are responding to the monkeypox outbreak. But there is a level of urgency here, and we are seeing resources being mobilized. Now, that's the federal government. Because we have a decentralized public health system, a lot of the fight against monkeypox is being waged on the state and local level. And over in Florida, we saw Ron DeSantis being very dismissive of the monkeypox outbreak and suggesting that this is another issue where the left is fear mongering and that this is not something that he's going to be declaring an emergency over. So there's varying degrees of urgency that we're seeing based on the level of government. Talked to I've talked to a patient who contracted monkeypox, and when he called the local health department, they had no idea what he was talking about. So
Yeah.
there is a patchwork of urgency. There's a patchwork of seriousness in the response to the monkeypox outbreak up and down different levels of government.
Yeah, will there be a kind of a blue state, red state thing where maybe blue states will be more um, proactive or
It's something we're monitoring. I mean, the early hotspots for monkeypox have largely been in large cities with significant gay populations. New York City, San Francisco, Washington, D.C. The mayors and public health leaders of those cities have been really ratcheting up pressure on the Biden administration, particularly San Francisco Mayor London Breed and New York Mayor Eric Adams, in getting more vaccines. And that's a testament to the growing political power of the gay community. And that's a big difference from HIV in the 1980s.
right? Well, Fenit Nirappil, thank you so much for taking the time to talk with us about this concerning issue, but also one that, like I said, is fluid. And I hope you'll leave the door open for us to come back to you down the road here and do a little bit of an update about where we are.
Yeah, absolutely. And I really appreciate your time and attention to this important topic. And I guess the one other thing I would add for just your broader audience who's listening to it is like I emphasized here that the highest risk is among gay men and other men who have sex with men. Monkeypox is also something to have in the back of your mind if you have an unfamiliar rash. When you're seeking medical attention, just recognize that monkeypox is a new virus that's circulating out there, and it is something worth talking to your doctor about because it's not only limited to gay and bisexual men, and we are already seeing spread outside of those communities. So it's just something to bear in mind when you have unusual symptoms.
All right. Fenit, thank you so much.
Thank you
And
so much.
yeah, and great work that you're doing there with the Washington Post and the rest of your healthcare coverage team. You guys are busy and dealing with a lot here.
It's one thing to the next, isn't it?
Yeah, no, it is.
Unfortunately, it is.
That is. Thank you so much.
All right. Thank you.